morning, Fatma. How are you?
Good, how are you?
I'm good. Have a seat.
Thank you.
How have you been?
I've been great.
Everything all right with the baby?
Wonderful.
Oh, I'm glad you came back for another visit.
Thank you.
So, are you ready to talk about how to best help your child develop and grow?
Of course, doctor.
That-
Always ready.
I know, that's very good. I'm going to bring up things you can do that will play a big role in the health of you and your child.
Okay. I guess that the first point you want to make is how my family should always use safe water for drinking, cooking, washing, cooking utensils, and, washing food that we eat.
You know me very well, Fatma.
I know we need to wash our fruits and vegetables as well. We should also use safe running water with soap to wash our hands before and after any situation that we might be exposed to microbes so that they won't get into our bodies. That's me and my family, right?
You are such a good learner, Fatma.
Thank you.
So, let me just ask you, let me see if you remember even more.
Okay.
What other situations would require hand washing?
I believe before eating, feeding my baby, preparing food, caring for a sick person, and after using the latrine, of course, as well as changing a baby's diaper, caring for a child or a sick person, after sneezing, coughing,
That's
touching
very right.
things that might be contaminated by microbes. Parents should teach their children, as I should teach my children,
Yeah.
to wash their hands as well, so they are not infected with microbes that might cause diarrhea, parasites, and other illness. Let me see. First, I know that children are exposed to many microbes when
Yeah,
they
that's
crawl
true.
around. Get their hands on the dirt. They put them in their mouths. Most of the time they touch toys, put them in their mouths. This is where the microbes are swallowed. Washing can help them by, removing the microbes and preventing the microbes from entering their bodies, hence make them sick.
That was such a good summary, Fatma.
Thank you.
That was very, very, very good. I'm very impressed.
Thank
And
you,
how
Doctor.
about breastfeeding, Fatma? What should you do? Do you remember?
I think I know. I should use only breastfeeding for the first 6 months of my baby's life and then continue breastfeeding, gradually increasing supplements, feeding until my baby is about 2 years of age.
Yes.
Only then can breastfeeding stop, or I can continue. Can I?
Yes.
Okay. And I should always give my child as much breast milk as I want, and should even increase the amount of breastfeeding if the baby is ill, because that's the time it really needs more fluids and nutrients to fight the illness. Am I
That's
correct?
very right. But you said breastfeeding as much as the baby wants. You're right.
okay.
But you're very right, Fatma.
Thank you. Then
Tell me more.
during our last visit, you mentioned supplemental feeding of food while breastfeeding. I would like to know more about supplemental feeding so I can do it properly for my child.
That's good, Fatma. And that's exactly what today's visit is all about.
Okay.
So supplemental feeding is simply the food you give to your baby in addition to breast milk from 6 months until 2 years.
Okay.
It is also called complementary feeding.
Okay.
You will be breastfeeding exclusively before 6 months, and your child can stop breastfeeding at 2 years old. But complementary feeding is the food that's needed between those two ages, between 6 months to 2 years.
But why is it important? Won't the child know what to do naturally?
Not really. So for the first 2 years of a child's life, these are very, very crucial years. And to the child's health, this is the time that you build up the child. So if whatever you do in these first 2 years of life can affect the rest of the child's life, and it can even progress into adulthood.
Oh my.
Yes. So when a baby is born, many parts of its body are still developing. The brain especially needs much, much more time to completely form and so do many other organs and body systems, such as the ability of the child to fight infection.
Oh.
The baby's body is also growing very, very fast.
Yes.
It's much faster than at other times of life, so more nutrients are needed for this fast growth.
Okay.
The growth and development of a child depends on having a good supply of nutrients in the diet.
I understand.
And as I've told you before, nutrients are the things that you may have heard about.
Yes.
These are proteins, fats, carbohydrates, vitamins, and minerals. These nutrients are needed to make new tissue for the body, such
Okay.
as brain, blood, muscles, and strong, healthy bones. They all depend on nutrients.
Wow.
If we don't give the child enough building block nutrients during these early years,
Yes.
the child's body will not be able to properly develop these tissues, and lifelong deficiencies can result.
Oh.
For example, the brain may not develop fully. The bones won't grow as much as they should, or the ability of the child to resist infection may be reduced. And unfortunately, many developmental deficiencies that are present by age 2 cannot be reversed, even with proper nutrition later. It's just too late.
That is very scary.
It is. And when a child is not eating enough nutrients to enable its body to grow and develop properly, we call this condition malnutrition.
And if a child hasn't had proper brain development, how does this show up?
So, a parent might notice altered behavior such as fearfulness or irritability or reduced responsiveness. If the child's brain has been impaired, one can notice these things.
Okay.
The child may also be performing poorly in school,
Wow.
or they can have difficulty with controlling body movements.
Okay.
But this limitation can affect the child's entire life due to lack of education or reduced income potential because now they're not able to concentrate and focus.
Correct.
And they may end up having family relationship problems.
Oh, I didn't know about all this, doctor.
It's very, very important to know, Fatma.
Thank you.
This is just the impact of poor nutrition on the brain.
Okay.
As I said, poor nutrition affects other parts of the body as well,
Wow.
such as the ability to fight off infections and even how tall a child will be.
Wow.
Children with poor nutrition are more vulnerable to many diseases and illness and have a higher rate of illness later in life.
Wow.
Children who were poorly nourished have an increased risk of death even as adults.
Oh my.
So you can see why nutrition is very, very critical for children under 2 years old.
It is, doctor. And these are shocking news that I didn't know. And I'm glad you just mentioned them.
I'm glad you are learning them, Fatma.
Yes. Thank
Malnutrition is the world's most serious health problem, and it is the single biggest contributor to children dying.
you. Okay.
Healthcare providers can evaluate the effects of a child nutrition by taking body measurements to see if the child is stunted.
Okay.
You know, when the baby comes and we check the height and we check the weight, we see how the baby is growing.
Yes.
But let's talk a little bit about stunting.
Okay.
So stunting means the child's growth is impaired and the child is smaller than it should be.
Okay.
And stunting is present if the child's height does not compare to the height of the other children under 5 years old.
Wow.
So we compare this child height to other children around the same age. And of course, children vary in size, but a stunted child is shorter than other children, even considering normal variations in size. It may be difficult to be aware of, so growth measurements taken over time are important for the evaluation of stunting.
So you're trying to tell me stunting is lack of growth due to inadequate nutrition?
Yes, Fatma. It is generally due to a poor diet of the mother during pregnancy or poor diet of the child during the first 2 years of life.
Wow.
Illnesses like malaria or parasites in the pregnant mother or child can also contribute to stunting.
Okay.
All of these conditions are a stress for the child's body and they can result in stunting.
I understand now.
But I need to tell you about another threat to the growing child called anemia.
Okay.
I know we've mentioned a little bit about it during that it can happen
Yes,
to
we have.
pregnancy. I'm glad
Yes.
you remember that. This can also happen to a child.
Really?
So as I said before, anemia is a medical condition where the blood lacks enough red blood cells or iron.
Okay.
And the blood need that iron to be able to function properly. So the body needs healthy blood to properly develop,
Okay.
to be able to, for the body to grow, and also for the body to be able to fight diseases. And as I mentioned before, proper growth and development is especially important for young children because growth or development shortfalls can affect them for the rest of their lives.
Wow.
So like stunting, anemia is very, very common throughout the world. Actually, about 3/4 of the children under 5 in Africa are anemic. And also like stunting, anemia is hard to see, especially in children. In fact, it is often called the hidden hunger.
Wow. During our previous meetings, we talked about how anemia affects or often affects a pregnant woman. It also happens in children?
Yes,
Wow.
anemia is common in pregnant women, just as you said, but it is common in children as well.
Okay.
So we need to take precautions to prevent it. A pregnant woman should eat a diet high in iron with red meats, dark green leafy vegetables, beans, and nuts. And remember, take supplements of iron and folate, all this to prevent anemia. If she took these precautions and had a healthy baby, breastfeeding alone for the first 6 months usually supplies enough iron to prevent anemia from developing in the baby.
When my baby is under 6 months old, it will only get my breast milk. Is it enough for the baby?
I know you are still concerned about that.
Oh.
Yes, babies that have iron deficiency anemia are usually born very small and anemic due to inadequate prenatal care and nutrition through the mother.
Okay.
Or they develop anemia because they were not breastfed. That is why I'm stressing good care, nutrition, and supplement during pregnancy so the baby is not born anemic. And then exclusive breastfeeding until 6 months old so the baby does not develop anemia after birth.
Okay.
If your baby is small at birth, we give the baby iron supplements starting at 2 months to be sure it has the needed iron. We may also do this for children of normal size as well.
How about after the period of exclusive breastfeeding when my baby is 6 months old?
So after 6 months, the child is growing very fast and needs even more iron. This is the time when foods other than breast milk are starting to be fed to the baby. So we need to be sure we give the baby foods that are rich in iron, just like we did with the mother, such as red meats, fish, poultry, dark green leafy vegetables, beans, insects, squash and pumpkin, liver and kidney. These, especially liver and kidney, are particularly very rich in iron.
Okay. I am eating the same foods right now during my pregnancy. I know that beef, liver is all rich in iron. When my baby is over 6 months old, can I start feeding it all these foods?
That's true. You can absolutely start feeding your child these foods.
Okay.
And be sure to add fruits and vegetables,
Okay.
especially oranges, tomatoes, and fermented porridge, because these also help the body soak up the iron that is in the other foods.
Okay.
You should also look for iron-fortified foods, such as cereals and breads. That means that iron has been added to them. You can even add iron to your baby's food by putting a tasty supplement powder called sprinkles on it. Many babies, especially those who are small at birth, will be started on supplemental iron syrup when they are 2 months old.
Okay. Okay.
And the decisions to start supplemental iron and how long to continue it are based on your baby's progress and other health factors.
Okay.
For example, if parasites or malaria are a problem in your community, health officials may recommend additional iron supplements because these diseases can contribute to anemia in your child.
Okay.
And this is also how government health officials decide on intermittent treatment of malaria and also deworming programs.
Okay.
We will evaluate these needs for your child when you bring it for its regular healthcare visits.
Okay.
The other thing, Fatma, that I want you to be aware of is that you should not give your young child tea or coffee. I know you like coffee because this can prevent the body from absorbing iron.
Okay.
And remember that taking care to wash your hands and the baby's hand frequently also keep you both healthy and reduces the chance of anemia from illness.
Okay.
So, Fatma, another thing that I want also to talk to you today about, it, in addition to iron, is vitamin A.
Okay.
This is another important nutrient that helps to prevent anemia.
Okay.
And vitamin A also prevents a medical condition of eye dryness. It's a very common cause of blindness and may reduce the risk of pneumonia as well.
Wow.
So foods that are rich in vitamin A include all types of meats and dark green leafy vegetables such as spinach and kale and the tops of beets, collards or turnips.
Okay.
These are all rich in iron, just as we talked about.
Yes.
And foods that are rich in vitamin A are orange or yellow vegetables and fruits.
Orange and yellow?
Yes. Carrots,
Oh.
pumpkins, squash, cantaloupe, red peppers,
Okay.
red palm oil, and mangoes. You see what I mean?
I understand. So if I feed my baby meats, dark green leafy vegetables, orange and yellow vegetables, beans, fruits, and fortified cereals, that would be a healthy diet? And it also sounds very colorful.
It is, and baby gets attracted to the color and they
Ew.
end up eating quite a lot.
Wow.
You are very right, Fatma.
Amazing.
But you can also give your child nuts, but they must be ground up into soft food so the baby doesn't inhale or choke on them.
Okay.
We will give you a high dose vitamin A to take within 4 weeks after your delivery, and then give your baby a vitamin A capsule every 6 months for its first 2 years to make sure you both have enough vitamin A.
Okay. Okay.
So I think now you can see where a good diet with lots of iron and vitamin A helps prevent anemia.
I see that, doctor.
But there are some other things that can cause anemia as well. For
Really?
example, malaria.
Oh.
Malaria can destroy your red blood cells and can even cause severe anemia. And there's also intestinal worms. Remember we talked about that a little bit before.
I remember.
Yeah, intestinal worms can cause blood loss. And they can also steal some of the nutrients you're eating or even cause tissue damage, all of which cause pneumonia. And they also cause stunting. So you need to use insecticide-treated mosquito netting, safe water, and wear shoes to prevent these diseases. We'll talk a little more about these infections in our last talk.
Okay. Okay.
But this would be a good time to talk about complementary feeding, Fatma. What do you think?
Yes, I think that would be great. I have been wondering how exactly that works. Complementary feeding, you said, is from 6 months of age until 2 years old, right?
That's right, Fatma.
Okay.
The child should always have as much breast milk as the baby wants until it is 2 years old.
Okay.
We are just adding in other foods as well to help it grow and develop properly.
Okay.
So complementary feeding involves all the foods we were just talking about. Meats, fish, dark green leafy vegetables, other vegetables, fruits, and cereals. But it is best to use fortified cereals and sprinkles on foods because of the extra iron they contain. Beans and rice, cheese, yogurt, nuts, seeds, insects, eggs, and oil seeds are also good. You know about porridge, right? Yes. So porridge often has large amounts of water, which doesn't have the nutrients needed for the child. So only give porridge if it is not watery.
Okay.
Like maize porridge has iron that is difficult for the body to absorb. And fermented porridge, however, helps with the absorption of iron.
Okay.
And as I said before, do not give tea or coffee and limit starchy foods.
Okay.
And just stay away from sugar and sugary drinks
Okay.
because these cause tooth decay.
Okay.
And also don't leave food overnight because it can spoil and can make your baby ill.
Okay.
You get that?
Yes.
And now let's talk about how to feed these foods.
I know. I need to wash my hands and the hands of my children before we feed.
Yes.
Okay.
And always use safe water and soap
Yes.
to wash the eating and cooking utensils.
Safe running water.
Your baby, yeah, absolutely, you're very right. Your baby can become ill more easily than later in life. So
Okay.
extra care is really needed at this point.
Okay.
But the baby cannot chew food like an older child, so you need to crush the food for it.
Okay.
The baby can eat the same foods as us, they just need to be mashed or pureed, so they are semi-soft and easier for it to eat.
Okay.
So at 6 months, you start slowly with a few spoons of soft foods or semi-soft liquids, but be patient and don't force feed the baby
Okay.
because your baby may choke. Just let the baby get used to these new foods and flavors slowly.
Okay.
Once the baby gets used to eating food, gradually increase the frequency and amounts of food the baby eats each time.
Okay.
After a few months, your baby should be getting at least 3 meals per day.
Wow. Okay.
You can also give them some finger foods, and these are the foods that baby can eat by itself without a spoon. They can just pick and put in their mouth.
Okay. Finger food.
And
okay.
then by 12 months, they should be eating at least 3 to 4 meals per day and at least 1 snack of finger foods per day.
Okay.
And then you can increase this to 4 to 5 meals per day and 1 to 2 snacks per day by the time they're 2 years old when you stop breastfeeding. Oh, children are just like chickens. They need to pick at their food all day long, all day long. They do that, but that's how they can grow healthy and strong.
Oh, there's a lot of different things that are needed for a baby to grow up healthy and strong. And they seem to all link together.
That's true.
For example, anemia and stunting are related to the nutrition of the pregnant mother and the baby, and malaria can cause anemia as well.
You said quite right, Fatma.
Okay.
You know, I like to think of health as like a woven basket.
Okay.
If you're making a basket with only few strands of reed, it will not be very strong.
True.
But if you use many strands, the basket will be strong, it will be flexible and
Yes.
durable. So it is just like this with health.
Okay.
If we use latrines, safe water,
Yes.
we wash our hands, we do a good selection of food,
Yes.
we do birth spacing, use LLIN mosquito nets,
Yes.
you make sure you get at least 4 antenatal care visits,
Yes, correct.
breastfeeding, supplement to iron, folate,
Wow.
vitamin A. If we give vaccinations, we wear shoes, we take the intermittent preventative treatment for malaria,
Yes.
and as well as prevention from other parasites. If you do not smoke, you do not use illegal drugs or alcohol, then we will have a healthy, strong, and resilient child.
Yes, correct.
All of these health items help each other be stronger, just like a basket that has many strong interwoven fibers.
Yes. It seems a lot, but if you look into it, everything makes sense now. And you gave me the example of the basket, and that will stick in my head for a while. Thank you, Dr. Gwantwa. This meeting has been helpful.
I am very glad
And the
you came,
basket will
Fatma.
be the key.
You always remember that, Fatma.
Thank
So
you.
I will see you for our next talk.
Thank you.
And we will talk more about how to help children grow by reducing stunting and anemia. And I will explore more about that then.
Okay, thank you, Dr. Gwantwa. You have been wonderful as always.
Thank you, Fatma.
Okay, bye.
You are
It's
very
good to
welcome,
see
and
you,
I will
doctor.
see you again.
Okay.